Welcome, ladies. It's that time again. So if you would like to say hello to me, perhaps Liz, Darcy, hello to me. Get me warmed up before we start. Who wants to go first? Welcome, Jamie, as well. Hello. Please feel free to put your camera on, unmute yourself, say hello to me.
Hello.
Hi, Liz. How's my girl? How are we?
Good. It's sunset here. It's really nice. Pretty.
This is
I'm out.
perfect.
Yeah, I'm outside.
Awesome, darling, soaking in this energy. I've got some lovely
Mm.
gems for us today, so welcome aboard. Darcy, how are you, my love?
Hey, I am just sipping on some tea right now, and I just got done with the acupuncture, so I think I'm doing good.
You are in a good, you're zen. I love this. Mindset to be starting our meeting today. Divine, honey. Jamie, do you want to say hello? Please come say hello.
Hi. Good evening.
Good evening.
What time is it for you?
It's 10 a.m. in Australia.
Oh, okay.
Yeah, it's bright
Yeah.
and early here. Yeah. Where are you joining us from, Jamie?
Oh, I'm Toronto, Canada.
Oh, nice.
So it's 8 o'clock.
It's on my wish
And it's
list.
7:30 or 8 o'clock. I don't know. 8 o'clock.
You want to share a
PM.
little bit about your journey with us?
Yeah, my journey is not like going anywhere right now. It's kind of like still, right? But I'm just kind of starting it, I guess. I have your book. I haven't gone through all of it yet, but I'm a little stagnant right now. So I don't know, like I'm trying to figure out exactly what I'm doing, but I want to have a baby. So that's why I'm here. But I'm like 45-ish. 45, and then actually my birthday's this month, so I'll be a little bit older.
Hey, it's the energy of the number 5. I don't know if you're into numerology, but this is a great month to have a birthday. Great year to make a baby, but also a great month for
Sounds
manifesting.
like a plan. I
Absolutely.
wish that. I did wish. I made a wish for
Let's do
this
that.
month.
Let's do that.
So we'll see. I'm like,
Yeah.
before my birthday. Come on, let's go.
Let's do it. Let's do it. So welcome. Please join any of my live Zoom meetings. There's many resources that I have, and you're more than welcome. I'm doing these weekly.
Oh, yeah, I missed last week, but I'm here today and I saw a first one a couple weeks ago.
Fantastic. All right. Well, let's make a start, shall we, ladies? Let's get started. So welcome, Renata. I can't see you, but I know you're watching, so welcome aboard as well. I'll get started, and I'm going to try and keep this as brief as possible. I tend to be Miss Chattybox and get lost in translation, so I'm trying to keep this concept of thyroid very simple because it's such a big marker. And I find that most of us at some point in our lives have an issue with our thyroid, and it's so important. So I want you to stick around. I encourage you to stick around to the end because we can put on our cameras again and have a chat. So don't drop your questions in the chat. Put them to me face to face, so then we can have a mini consultation and I can answer your questions direct. So put your camera on at the end of the meeting. So let's talk about thyroid disorders and how it affects your fertility. So if we just start at the basics, like let's just look, where is the thyroid? So it's this small little, it's like a bow tie, I call it a butterfly shaped gland, and it's on the front of the neck. All right, it's just below the Adam's apple, and it wraps around the windpipe, which we call the trachea, and it's pretty much responsible for so much of the metabolism. It modulates the ovarian, the uterine, and the placental tissues, and we need it really, all those hormones functioning for your reproductive system. So there's many types of thyroid disease. However, I'm going to keep it very basic and simple for the purposes of this meeting so I can get to your questions. So if we look at thyroid disorders that we most commonly see, the most common two is hyperthyroidism. This is when the thyroid activity is overactive. You've got too much thyroid hormone. Your thermostat's really out. And so these women tend to be really hot. I'll go more into these the signs and symptoms as we go through the talk. Then we've got the hypothyroidism. This is the underactive thyroid activity, and this is where there's too little thyroid hormone production. So both hyper and hypothyroidism can cause infertility by affecting ovulation. And then, you know, if we're not ovulating, and then, you know, it can mess up with the period. Sometimes we can have oligomenorrhea, we can have amenorrhea. If it's hypo, we'll often see menorrhagia, like lots of bleeding. So I'll go into this further along. But if we look at, you know, if it's untreated, when they're untreated, how is it going to affect you and the baby? So untreated during pregnancy can lead to, if you're looking at the hyperthyroidism, you've got issues with miscarriage, premature birth, you've got low birth weight. These are the complications. Preeclampsia, which is the dangerous rise in your blood pressure in the late pregnancy. And then you've got a thyroid storm. So when you get pregnant, suddenly everything just goes completely out of whack. And then there's a small risk, but I need to mention it, you've got congestive heart failure. With the hypothyroidism, there's a lot of crossover. You'll see there's a lot of crossover because they flip. They can go one to the other. And that's where it gets complicated. But with the hypothyroidism, if it's left untreated during pregnancy, it can lead to, again, preeclampsia. That's that rise in the blood pressure. But we have more things to do with like anemia, miscarriage, stillbirth, again, low birth weight, and then again, congestive heart failure, although rarely. But pretty much these two, hypothyroidism and hypothyroidism, they affect the thyroid gland, and there's also usually an autoimmune component. So if we look at the autoimmune component, this is like the umbrella. Okay, so Graves' disease and Hashimoto's disease. So Graves is the most common cause of the hyperthyroidism, while the Hashimoto's, it's by far the most common cause of the hypothyroidism. Okay, so if we look at, you know, roughly what's more common, I tend to see in clinical practice, there's more Hashimoto's. And then there is Graves that I've treated in clinic. Hashimoto's disease affects roughly around 4 out of 1,000 women and about 1 in every 1,000 men. So you can see that it's more prevalence in women than there is with men. So you see that the hormones have a big role to play in this. So the Hashimoto's thyroiditis, this is the underactive thyroid. This is actually where the immune system's actually malfunctioning. It's attacking itself. The self-antibodies are attacking the thyroid tissue as if it's foreign. And so basically there's a lot of triggers I see with it. So, you know, let's just cover the basic ones. So it can be excessive iodine may trigger thyroid disease. It can be that hormonal component, because women are more affected, as I mentioned, than men. And lastly, there can be a genetic component, partly because, you know, multiple people in the family often have thyroid disease or autoimmune diseases. But then the triggers I see in the clinic, all right, so there's usually high stress. There can be a trauma event, and there can even be a night shift. You know, I treat a lot of nurses and policemen, and their circadian rhythm, you know, when you're doing night shift, the circadian rhythm is out of whack, you know, and it can go on for too long. And, you know, you're on night shift, you're off night shift, you're on night shift, you're on from off night shift. And it's really difficult for night shift workers, because it's not, I don't want people to lose their jobs or leave their jobs, but it can affect that thermostat. Because really your thyroid gland, I talk it, it's like the thermostat going up, thermostat going down, thermostat going up, thermostat going down. Think of it like a thermostat. That's how I like to think. Simple. That's what it's like. And then the other thing is like whiplash can be a car accident. So, you know, that's that feeling. All right. So it can be these things that are the trigger. So with the Graves, it's named after the physician who actually discovered it back in 1835. And patients with Graves' disease, they produce these proteins called thyroid stimulating immunoglobulins. Try and say that fast. Anyway, as a result, the thyroid gland basically gets tricked in producing more and more thyroid hormone, thus producing the hyperthyroidism. So let's look at the symptoms now. Let's go in, let's run through them pretty quickly. So with the hyperthyroidism, this is the Graves, all right? So you'll often see the real bulging eyes, okay? That's the one of those clinical features that you can just really see it quickly, all right? Bulging eyes, swelling eyes, There can be, you know, red, itchy eyes, and there's a lot of swelling there. So the eyes are a giveaway. It's the goiter. All right, so it's the increased size in the thyroid gland, but you can get that with Hashimoto's as well. So it gets a bit confusing because there's a lot of crossover, as I mentioned. But with this type, this is where they're the anxious type. They're anxious. They've got abnormal heart arrhythmia, palpitations. They, you know, their thermostat, they cannot stand the heat. They've got excessive sweating and heat intolerance. All right, and they're losing weight in spite of the increased appetite. Okay, so again, we've got hair loss on both sides with hyper and hypo. So that gets a bit confusing. With this type, you'll see more diarrhea. That's the heat. You know, it tends to create the heat with the intestines and the stool. There's fatigue, decreased concentration. And then with this type, I tend to find this is where the periods get affected, where they're maybe not menstruating. They might have, which we call amenorrhea. They might have irregular periods, oligomenorrhea, or just a decreased menstrual flow, which we call hypomenorrhea. Or with Grace, now if we want to look at it, how conventional medicine will run through the testing, and you know, it's important that we do understand that you are getting the proper testing. All right, so there'll be a complete medical history, a thorough physical examination, an ultrasound. They'll often do that. Blood tests. We're looking at TSH, T3, T4, and we're doing that with both of these conditions. Then we're looking at the thyroglobulin antibodies, the thyroid stimulating immunoglobulins. We want them below 20, and the thioperoxidase antibodies below 20. So, you know, sometimes I might see these TPO antibodies like 900 plus, you know, it's pretty full on. So, you know, these bloods, people will come to me with these bloods. The great thing about Chinese medicine is that we have our own system of diagnosis. We take this into consideration. I'll put this on your file. Yes, and yes, we relate it back into Chinese medicine language, but I can actually treat you without these tests. I know that sounds crazy, but Chinese medicine, we look at the whole body. It's a very holistic approach. But if we're looking at the medications that would be prescribed from conventional medicine, we've got anti-thyroid medications. It's the methimazole, and the second one is the propyl thyrorasol. PTU, let's say PTU for short. Propylthyrorasol, I think that's called it. Anyway, I'll put it in the link below because I'm getting tongue-tied saying that. But these medications are just literally these anti-thyroid medications to suppress it. Okay, there can be radioactive iodine therapy that is often used in conventional medicine. Then surgery is probably the end result. That's when, you know, it's a total thyroidectomy. All right, if the hypotype, let's go into those symptoms. So there's a lot of cold and fatigued, a lot of gaining weight, feeling cold, feeling down, depressed, low motivation, fluid retention. They tend to have more constipation. All right, because everything's slowing down. Things are just not moving. Again, we've got the thinning hair and the hair loss. All right. Now, one of the signs that I look for, and this is a real giveaway, often it's the first clinical sign of hypothyroidism, it's this lateral eyebrow loss, the Herdiger sign. All right, this is a classic sign of, you know, Hashimoto's, and you might see that first, just like all of a sudden your eyebrows drop off. Okay, so yeah, it's called eyebrow hypotrichosis. It's the loss of the outer third. That outer third. So, you know, you might be talking to someone and then all of a sudden you're noticing their eyebrows and you're like, this person looks like they've got Hashimoto's. And you could be a diagnostic person already. You're already starting to diagnose. Okay. Now, changes in appetite, lots of sleeping issues here, the slower heart rate as opposed to the fast heart rate. So you can see that there is a little bit of crossover. But the thing is, when we're treating hypo or hyper, they can flip. And so that's why you have to have regular testing to make sure you're in the right limits, all right, with your bloods. All right, so I tend to work integratively. I like working with Western medicine and Eastern medicine. Remember, I'm a doctor of Chinese medicine, so I'm always going to infuse Chinese medicine over the top of this. But, you know, functional medicine, again, for Hashimoto's, it will do, like the hyper, it will do the medical history, it'll do a complete physical, ultrasound, your blood tests. In addition to all those that I mentioned for hypothyroidism, then they might look at some mineral and vitamin status. So you might look at iron, you know, if there's anemia with this type, so iron and ferritin stores, we might check out zinc, selenium, magnesium, your vitamin D, especially when the mood's so down. All right. And then, you know, there can be an iodine loading test. It's a 24-hour urine test. Now, the thyroid medications used for your Hashimoto's and your hypothyroidism is your levothyroxine, it's your L-troxin. These are your thyroid hormone replacement. All right, then you've got your natural desiccated thyroid supplements. So this is your Armour thyroid, your NP thyroid. There's a few of the others, WP thyroid, ERFA thyroid, and the Nature thyroid. All right, so there's a plethora of medications that are used for this. So now we're going to jump into Chinese medicine. Remember, I'm a doctor of Chinese medicine, so I'm always going to treat it from the Chinese medicine perspective. So from a TCM, that's traditional Chinese medicine perspective, we will look at always, we're looking at the state of your yin and yang. So, you know, when the thyroid's out, you know, there's usually an imbalance of yin and yang. All right, then we look at, you know, the Ren, the Chong, all right, so I'm going to be working with your fertility. These are these meridians that are involved in fertility. So I'm going to be looking at that. Then it's the state of your heart, your spleen and your kidneys from a Chinese medicine perspective, and particularly the spleen. All right, because the spleen's involved in the thyroid function. It plays a role in the metabolism, your microbiome, your appetite regulation, and it's you know, it's like it regulates your weight loss or your weight gain. So it's the spleen chi in Chinese medicine. Spleen plays a big role in this, but heart and kidneys is to a lesser degree. We have a little bit of the liver there, but let's break it down. All right, let's break it down really simple. So if I'm working with Graves, or if I'm working with Hashimoto's, all right, I'm looking at the heart and the kidney connection. We call this the Shaoyin. This is where the heart is not communicating with the kidneys. So the heart is the fire, the kidneys is the water. This balance gets out, all right? So I call this the Graves' disease is the Shaoyin hot, and the Hashimoto's is the Shaoyin cold. Got it? Shaoyin hot, Shaoyin cold. All right. But in addition, with Graves, I'll often see a lot of heat stuff. So blood heat, yin deficiency, so the heat rises, all right? Blood stagnation, qi stagnation. And then with Hashimoto's, it's really depleted, all right? So we've got blood deficiency, yang deficiency, because that's cold, all right? Qi deficiency. So you see one's a real deficient pattern, deficient and cold. The other one is a little bit more excess. Not necessarily, sometimes, I mean, there's deficiency with Graves, but there's a lot of heat. So that's an excess thing, but also it comes from deficiency. It gets complicated with Chinese medicine, but I'm just trying to give you the lingo so you understand how I think when I'm working with you. Now, with the autoimmune layer, there's a bit of complexity because there's often another component with it. So this is where infections come in. So we call this GU syndrome. So this could be your Epstein-Barr. This could be lingering pathogens. All right, Giardia. Where have you been? What countries have you visited? What have you been? You know, some certain pathogens that you may have been infected with. All right, so lingering pathogens. I tend to find I use the GU syndrome. Those formulas when I'm treating that. Then we want to look at if there's a lot of blood stagnation. Are there food reactions? You've got food sensitivity, pesticides, toxic exposure, chronic infection, and inflammation. So there's so many layers to it, but Chinese medicine, it really peels it away, like peeling off that onion. Yes, I love it. I think that's what I love about Chinese medicine. It's just, it doesn't stop. It just keeps going. And, you know, eventually we'll find what the root is. Okay, because often in your bloods, you know, everything's in range and you're going, well, it's not really showing me anything with my conventional testing, but the Chinese medicine, it opens up a rabbit's warren. And finally, we can see those lingering pathogens and we can go in and we can treat them quickly. It's amazing. So when I'm looking at the nutritional and lifestyle guidance, when I'm working with hypo and hyperthyroidism, I'm going to be looking at your food and your nutrition. Specifically, we'll look at your goitrogenic foods. Now, these have a profound effect on blocking your thyroid gland. So they should always be eaten cooked. never eaten raw. So these are your brassica family. These are all your cruciferous vegetables. So what are they? Broccoli, kale, cauliflower, cabbage, bok choy, collard greens. What else? Brussels sprouts, sweet potato, spinach, arugula. We call it rocket in Australia, radishes. So all these things need to be cooked, all right, because we want your thyroid to be functioning, whether it's hyper or hypo. We want to balance oxalates, so we want to eat them in moderation. Now, let me jump on the oxalate bandwagon because I had so many of my patients on TikTok, and TikTok's great, but TikTok's not always right. In fact, Dr. Google's not always right. So I have patients that have got thyroid problems. They're like, oh, just look at TikTok. And anyway, so it's quite funny because literally you can eat them. What happens with oxalates, they create these crystals that can form in the thyroid gland. So what you want to do, and that's, it is in spinach, yes, okay. It is in beets and it's rhubarb and buckwheat, right, and miso soup and corn, all right. It's in potato and your beans, your navy beans and your cannellini beans. But if you consume, this is where Chinese medicine is all about the balance. Consume your calcium-rich foods with your oxalates because the calcium binds to the oxalates and then off we go. It acts as an escort. So that's when you use your calcium foods. What are they? Calcium foods. So let's look at fish, like, canned fish can be canned, but fresh is best. Sardines, salmon, tuna, all right, tofu. Your plant-based milks, because I get you off dairy when we're doing work with the thyroid gland, and I'll explain that next. But other things that are rich in calcium, let me think, Brazil nuts, what else? Sesame seeds, so your tahini spread, almonds, they're low in oxalates, all right? Kale is also low in oxalates. So you can eat the oxalates, just eat them in moderation. Eat them with calcium-rich foods. Got it? Beautiful. All right. Then we can go into, all these, these crazy domains. All right. So if you're coming to see me and it's really, you're off the chart with your TPO antibodies, they're up at 900, all these markers are out of whack, then I might put you short term. When I say that, it's going to be under medical supervision, all right, on the autoimmune protocol. I have so many of my patients coming in so restricted with the autoimmune protocol because it's so restrictive. It's not sustainable. It's just to get the thyroid antibodies down, get your thyroid functioning well. So it's avoiding grains and beans and legumes and eggs and nightshades, seeds and nuts and dairy, alcohol, non-steroidal. So you just think, what can I eat? Well, you eat a lot of veggies, a lot of root veggies, a lot of meats, a lot of offal, a lot of fruits, spices, and ferments. Okay, but it's a very short-term protocol. So I might do that 6 weeks. If it's really severe, no more than 3 months. 6 months is pushing it, especially in the fertility niche, because I actually need a lot of those foods for making babies and good, healthy embryos. So I don't tend to restrict you for too long. I get you back balance yin and yang, all right? Get the Ren and Chong, spleen, kidney, liver going, all right? And so then I might put you on an anti-inflammatory diet, especially if there's the hypothyroid, if the grays, all right? I'm going to add in some things like some iodine, some sea vegetables. So dulses has the highest iodine content. You've got to be careful though, because dulse being so high in the iodine and iron, it can actually throw out the thyroid. So, regular testing is important. You want to be testing your thyroid every 3 to 6 months, especially when we are optimizing medications and protocols. All right. So just be mindful of the sea vegetables, even though they are a good source of iodine. Foods that contain omega-3s. So that's all your fatty fish, flax seeds, walnuts, sardines. They help produce thyroid hormones. All right. Brazil nuts are an excellent source of selenium. They help with the thyroid hormone production. So I say 3 to 6 Brazil nuts because they're high in selenium. Beautiful. String beans, they're beneficial for the thyroid gland. All right. We want to make sure we're off the coffee because it is going to affect your absorption of especially if you're on your thyroid medication. That's why I get you off caffeine and dairy and gluten. Like these are my 3 non-negotiables, and alcohol, 4. There we go, 4 non-negotiables. We just really need to remove them because you'll see that your body starts to really take off. It's incredible because they're so inflammatory and then they're not great for the hormones. So when we're optimizing hormones and we're making good quality embryos, we take you off that anyway. So you may as well just get going with it. We want exercise, we want movement, all right? Because the thing is, even though you're not feeling great, all right, we want gentle. So time on feet. I find walking, gentle exercise, whether it's yoga or Pilates, just you've got to find the thing that you love doing, all right? But just think not excessive. When we're fixing thyroid disorders, we want just, moderation. I think of yourself like a lady. What would Lady Fiona do, all right? She's going to be working not VO2 max like a Formula One machine. She's going to be at a trot, right? If I'm on a horse, it's like we're going to walk on the horse. In music, it's andante, at a walking pace, all right? Then we've got proper sleep hygiene. I think this is probably the most important thing, right, when we are optimizing thyroid health. We want to have, I did a big talk on this just recently on proper sleep hygiene and sleep disorders. So we want a cool room. We want to make sure that you're off your digital devices by 7. We want to have you in bed by 10. So every hour before midnight is worth 2 hours. 2 hours, 2 extra hours. So if you get into bed at 10 and asleep by 10:30, you're getting like an extra, 3.5 hours sleep. Unreal. Okay, let's go to sleep at the same time, wake up at the same time. Wear your blue light blocking glasses. Liz had these on one of our last coaching calls, and it was great. She's already implementing the medicine. Well done, Liz. Love you. All right, blocking glasses. We've got blocking curtains because we want to black yourself out because we're talking to the circadian rhythm. We've got to get that circadian rhythm. You'll see that was one of the triggers for the thyroid going out when you've got night shifts. So we've got to get the proper sleep hygiene. So morning sun exposure is important. Get outside, calibrate your circadian rhythm with morning sun. So wake up and open the blinds. And then if you can, walk early in the morning, even if it's 20 minutes. Morning sun, get outside, be amongst nature. Appreciation, nature walks, awe, gratitude. All right, these are all really important because we live in so much artificial sunlight. All right, we live indoors way too much. And we need to even just bask in the glow of the sun. It is the giver of life. All right. Epsom salt baths before bed. And then I get a lot of my patients, when I'm working, I do a lot of breathing. All my patients, they learn all these crazy pranayama techniques. I'm a yoga teacher as well as a doctor of Chinese medicine. So I'm always infusing the pranayama. My favorite breath work with thyroid is 478. It's really great because it literally turns on the parasympathetic nervous system. So it's 6 rounds of this, 6 to 8 rounds. So we breathe in for 4 counts, hold for 7, exhale down the slippery dip for 8. So in effect, it's, the extension of the breath, all right? The out breath. Inhale, pause, exhale, release the breath, but make it longer. That's 478. And you can feel the belly expand when you do it like this, all right? We want that belly to be soft. So in fertility, we want a soft abdomen. We don't want ripped abs. So if you're gripping your abs all the time, take a breath, breathe into your stomach, let it go. Let's become divine feminine. Breathe into that lower dantian, below the navel. We want soft tummies to make good quality embryos. We then want us to talk about, the conversion from your T4, which is your storage hormone, to your active T3. And to do this, I've got a couple of techniques. So liver detoxification pathways are important. You'll see that nearly on every talk I mentioned castor oil packs. We do them in fertility in the follicular phase. So from the last day you finish your period until ovulation, then stop. We don't continue the castor oil packs in the luteal phase. We'll do the abdominal gua sha with the castor oil. All right, now these actually work on those liver detoxification pathways and the lymphatic system. We'll also look at those cruciferous vegetables, make sure they're cooked, but they're good because they work on the liver pathways. It's got they're rich in diindolylmethane, which works on the liver. Or your alliums, onions. So your alliums are onions that are, garlic, onions, fennel, leeks, chives. They're really good for those liver detoxification pathways. So other things to help with the conversion of T4 to T3. So I'll get into supplements later. I like to work with food because it's number 1 on the umbrella. Food is your friend. I had one patient just recently. She had over 60, I think it was about 50 to 60 medications that and supplements. I was just like, it's a wonder you haven't got pancreatitis taking all those supplements. I'm a big fan of letting food be your friend. Let food be thy medicine. Hippocrates said it. He was onto it. Okay, so So let's look at, you know, your selenium-rich foods. So I mentioned that above: Brazil nuts, walnuts, mushrooms, avocados, fish. They're all high in selenium. Zinc is going to help with the conversion of T4 to T3. It's found in all of your red meat. It's found in your fish and seafood and some nuts and lentils, okay, and some seeds. Tyrosine. This is a precursor to your thyroid hormone. So it's found in meat. It's found in most proteins and pumpkin seeds, avocados. I just mentioned your essential fats. So, you know, think of, you know, your extra virgin olive oil, your flaxseed oil, your nuts, your seeds, and oily fish. And then low GI foods. They're great. They're great for the thyroid because we want to have sustained energy, you know, especially even with the they're burning out their energy. So we want low GI foods so we've got sustainable energy. All right, so leafy greens, berries, and you can even just Google low GI foods. Google it. Let's have a look at it. You know, add in some quinoa. There's lots of low GI foods that you can eat. All right, the guiding formulas in Chinese medicine, let's just quickly cover them because I like to infuse the Chinese herbal medicine, being a herbalist. And so in Graves, I'll often see the constitutional formulas I'll use is Tian Wen Bu Xin Dan. So that's that heart and kidney not communicating, all right? And they've got that excessive heat, insomnia, all right? And that nervous system exhaustion. That's one of my favorite formulas for that type. For the Hashimoto's, Guipitang, Yue Di Huangwan, Yogriwan, Shenqiwan, all right? These are the constitutional formulas I'll use for them. And then if you've got antibodies that are resistant to treatment, so I might use Xiao Chai Hutang, I might use Buzhong Yiqitang, I might go into the goo formulas. Remember, I've talked about the goo because they can go into those pathogens and they can find these pathogens and rip them out. And, you know, the Heine Fua, he's got this classical pearl range, and this is the goo formulas. Often I'll do these in the beginning when I'm starting the preconception protocol with you. I might do the goo formulas because they're very gentle on the gut, but they can go in and they can pull things out very quickly. Supplements, let's just quickly go over those. I'm getting to the end, so well done for hanging in there. All right, supplements. So we want the nervous system. What are we going to do? B complex. We want B vitamins. We want to support the adrenals. Okay, ashwagandha, vitamin C, vitamin E, magnesium. We want ginseng, vitamin D, zinc, licorice. So these all support the adrenals. Then we're going to look at your gut. So your gut is super important. So you could be taking probiotics, you could be taking glutamine, you could be taking zinc, marshmallow, curcumin. What else? Aloe vera. I'll often put that in the morning ritual, which I use in the morning, first thing in the morning, a glass of water with 2 tablespoons of your apple cider vinegar and your lemon juice. All right, it treats the gut, but you can add in some of your aloe in there. All right, then we can add in some collagen peptides. Bone broth. I'd call it the fertility elixir of life. It treats the leaky gut. All right, it's full of the collagen peptides. Then I might even add in betaine and pepsin if your gut enzymes are not good, or digestive enzymes, the Canadian bitters, fabulous, they're amazing. So if I'm reducing antibodies, if they're really crazy out of whack, all right, so I will do high dose selenium, around 200 micrograms of selenium, high dose myo-inositol. I will also add in black seed oil. It tastes terrible, but it's amazing. And then glutathione. Sometimes I will use that as a spray and just put it over the thyroid gland. Now, one of my patients, I want to mention her, she's a beautiful patient, and she recommended the doTERRA. This is the DDR Prime, and this is the On Guard. All right, so you can actually dispense it with a little ball and add in some coconut oil and just dispense it over the thyroid, direct skin to skin, like I would dispense the glutathione on the thyroid gland. All right, so these are some alternative remedies, and I love being alternate. I like being integrative and doing what works. All right, because my patient, she had her thyroid antibodies, her TPO antibodies, I think up in the 3 or 4, maybe even 600. Okay, 3 to 6 months on the doTERRA oils. And if anyone needs that, I'll put the links below what they are. And she got her thyroid antibodies down below 10. And she's been down there now for years. So she recommended that. And I'm passing this on for my patients to try, because I'm open to anything. If it works on one patient, why not give it to other patients? Acupuncture, let's quickly talk about that, because I find it just works. It works magic, all right? Because it can work on the Shaoyin like the Chinese herbs. It's going to communicate the heart and kidneys, work on the spleen, work on the Ren and the Chong. It's going to modulate the liver, all right? So acupuncture is incredible for working with the Shaoyin hot and the Shaoyin cold. All right, so I will often use points on the heart channel. So this is the heart channel that goes up the inside, the pinky side of the arm, goes all the way up to heart 1. Now I'll often use kidney 7, heart 7, Shen Men, but I'm talking about the kidney points on the leg. So imagine that's my foot. So kidney 6, I might use kidney 7. I might even use spleen 6. These are just points that I use. I'll often use with the grays, I'll use Sishin Kong. It's a group of 4 points. It's like at the top, if you put put your thumbs at the apex of the ear, join your middle finger, that's do 20, and then 1 thumb breath, we call it 1 sun, to each side. It's a group of 4 points, either side of do 20. It's called Sishin Kong. So you need all those 4 points, and it almost drains the fire down. I'll use Anmian behind the ear. I'll often draw that heat down the liver too. Okay, if it's the cold Shaoyin, the Hashimoto's, I'm going to use a lot of Moxa. So Moxa, I'm going to use Moxa. I might Moxa spleen 6. I might Moxa kidney 1. I might Moxa Ren 4, which is 1, 2, 3, 4 below the umbilicus on the midline. So the Ren channel. Okay, so it's amazing what you can do. And then finally, let me just talk about the ear points. This is an upside down fetus. How beautiful. Upside down fetus. And if I'm looking at the ear, the triangular fossa, right? That's the triangle at the top of the ear. Okay. We've got Shen Men there. All right. Shen Men in the uterus. So I'll get them to massage Shen Men and the uterus. So just massaging your fingers like this into that triangular fossa, and people love it when I put the ear seats in. I actually take it one step further, so you can get the ear seats, but I actually like the press needle. So I use press needles and I put in things like 0.0 Shenmen. I'll put in uterus. I might put in sympathetic and endocrine right down here on the ear. Anyway, you can leave them in sometimes up to a week, all right? But people love using the press seats and the press studs. So use your ears, rub the earlobes, rub the triangular fossa. So I guess now we're going to wrap it up and just keep it really simple. So I want to just mention stress. We've got to mention stress for either or, hyper or hypo, all right? With Graves and Hashimoto, you need to lower your stress. So how you do that? What are you doing to manage your stress? So is it you listening to music? Is it gratitude? Is it going into mindfulness exercises, meditation, breath control? I just strongly teach the patients, and we work with them to find the right protocol, because it's not one size fits all. Not everyone can meditate. Not everyone can be zen and be like a yogi. All right, we've got to find what works for you. So it could be just a nature walk. So I call it an awe walk, where you're just observing things in nature to de-stress, to slow down and turn on that parasympathetic nervous system. So I do strongly recommend that you address the stress. It's the #1 thing we need to work on with all thyroid disorders. And just remember, it's not about managing symptoms. It's about cultivating a lifestyle that supports optimal thyroid health. And just remember this, when your body is in a state of health and balance, fertility is your natural outcome. So thank you, ladies, for joining me. Thank you again. If anyone would like to unmute and ask me a question.
I have a question. Can you hear me?
Mm-hmm.
Okay, so you had mentioned about keeping, okay, so when I get acupuncture, she usually leaves the needles in there for 30 minutes and then it's done. But you had mentioned that some points on your ear, you can leave them in there for about a week.
Yeah.
So how do you get like these, how do you
the
do
press
that?
studs. Yeah. So
Okay.
I mean, you'll ask your practitioner.
Okay.
And if you don't know where to get them, I can send you a link where you can get them on Amazon. All right, so you can take them in and you can say, Dr. Fiona said, could you please put in these points? And they'll take them down and you can massage them and you'll feel the ball bearings. The ones that actually have the micro needles, which are my favorite, all right, what they are, they give you a zing, like you go, woo, amazing.
Yeah. I mean, I don't know. I just like I usually it kind of stings when she puts, especially down here, like on the very bottom. I have small ears, but like, but I really never feel the ones that she has up here. They don't hurt as much. But I have another question. You had also mentioned that Hashimoto's was it could be due to excessive iodine. Is that true?
Can be
Or
triggered
like,
from
how does that work?
and it can also it can be triggered from excessive iodine, like you could be eating too much of it. It can also be triggered by not having enough, so iodine deficiency. So it's like everything in nature. Too much of something, too little of something can create the trigger for it.
Okay. And I guess the way to tell like how much is okay is maybe like what do you
Doing the
suggest?
urine iodine loading test. It's a 24 loading test, and you have to collect your urine samples over a period.
Iodine loading test? Okay. Okay. How is that done? Is it like an at-home test or?
Well, it's not pretty, I'll be honest with you. All right. See this?
Uh-huh.
You get this container and you've got to
Okay.
carry this container around and you've got to urinate in it over a period of 24 hours. And and you've got to stay off certain foods. And so you're carrying around it's like, literally having a little urination bag with you. So every time you have to do you literally have to go into this bucket. Yeah.
Okay. And what do you do with that? Do you like, does it, so what is,
Yeah,
you
then it
you
gets
do-
sent into lab. It gets sent in for lab testing. Yeah, you collect the
Oh,
sample. It's
wow.
like doing the Dutch test. You know, how you do urine samples. Yeah, yeah,
Mm,
it's like that. But you
okay.
actually collect the full deposit.
Okay. Okay. I think, okay.
That's
I think
probably the
that's
most accurate. Yeah,
okay.
I have a quick question.
go for it, Liz.
Um, do thyroid disorders tend to run in families, like genetics? Because
There is
my mother and two of her siblings all have hypothyroidism. And I had some symptoms years ago. I got checked. My levels were normal, but I'm wondering, I do have a few of these hypothyroid symptoms that you had mentioned. So I'm wondering if I should get checked again or.
I think when was the last time you were checked? Because it can correct itself, and then I find that
A year ago. Yeah,
okay,
a year ago.
if it's been a year and you still got some of these symptoms, then yes, I would just check.
Okay.
Check your TPO antibodies. All right. Yeah. Do a full complete testing, a screening.
Okay. Thank you.
You're welcome.
Hi,
You're
can
welcome.
I ask you something?
Of course, Jamie,
Oh,
please.
sorry. My video might be a little choppy. It's something's going on with my computer. And when you're talking about the acupuncture, it was just reminding me last time when I talked to you, you suggested acupuncture. Like, I want to know acupuncture, how does it work when you do the acupuncture? Like, do you have to keep doing it over a certain amount of time and then it will kick in, or do you have to keep doing it ongoing?
This is a very good question. I love this question. And it's a brilliant question because it is cumulative. So when we're correcting things, it's not just like, don't get me wrong, I have a magic bullet sometimes and I just put the needles in and miracles happen. And I've had this happen so many times, but it's not how it always happens. So I would recommend, how long have your symptoms been there? As a rule of thumb, for every year you've had it, it requires 1 month of therapy. So if you've had these symptoms for 6 years, you'll need to have acupuncture 6 months. And I usually recommend weekly or fortnightly at a stretch to address them.
And then it's ongoing, like even after you do it and you have like reduced symptoms, you still have to keep doing it to like as if you're taking medicine, it's the medicine.
It's the medicine. It is. And especially if we're working on trying to make good quality embryos. What I love about regular acupuncture, and I have all my patients trying to do weekly, fortnightly acupuncture while we're in the preconception phase, and also then while we're trying. And then I even with my pregnant patients, I'll get them to follow it through, sometimes fortnightly, but some of them stay weekly all the way to the end, and then we do birth prep. So I keep it going until you've got the baby in your arms.
Hi,
Okay,
Dr.
ladies.
Sorry, my
Fiona.
video's cutting out.
Hi, Dr. Fiona.
Hello.
Can you hear me?
Hi.
Hey,
Yeah, okay.
the doTERRA, it's an essential oil blend, right? Okay.
Yeah. It's called DDR Prime. That's this one. DDR Prime. Can you see that?
Yeah.
DDR Prime. And this one, On Guard.
So it's both for the thyroid, or?
Both of them together. So you dispense them both together in a roller ball with some coconut oil, about 20 drops of each into a roller ball, like the dispenser, and you can roll it onto your thyroid as a remedy for lowering antibodies.
Nice. Yeah, because as you know, I have high thyroid antibodies, but
yeah,
it's an anomaly in my blood.
Look, this patient is yeah, I love to infuse some of these remedies that are working for patients that have had serious thyroid antibodies, TPO antibodies, and she lowered them with this remedy. So I just thought I'd make a little dedication to her in this talk and share the love.
Cool. Thank you.
Okay, now we have an unstable internet, so I'm going to wrap this up and say thank you very much, all of you, for your questions, for joining me. I hope you've got some good takeaways, some things that you can implement, and just know that I am running these Zoom meetings weekly. If you have any suggestions for fertility topics that you'd like to talk about, you can perhaps DM me directly, and I can cover them for you, because we all learn, and always feel free to join the lives, because they're great for you to learn and have a chat with me, a mini consult. And just remember that we all learn from the questions. So thank you for joining me. I'll see you again this time next week. Sweet good night.